थोड़ा सीधा देखना पड़ेगा नहीं तो you'll go out of the screen.
Okay.
Hello everyone, let's welcome Dr. Dipin, a proud Damzonian and rank 15 May AIIMS 2017 postgraduate entrance exams. Heartiest congratulations. Thank Dipin, you. It's a wonderful performance. How do you feel?
I don't have words to explain it, but I'm really happy.
He's really happy. He's short of words to explain it. Yeah. I am sure it's going to be that way because the amount of hard work you people put in, and you know, once you get your results, it is definitely overwhelming. So amazing performance, Dipin. And Dipin has been a student with us right from foundation. He did the foundation course with us and then followed it up with the AIIMS test and discussion course. So I would ask the questions about two separately. So let's talk about foundation first. Dipin, do you think the attending the classes is important?
It gave orientation. Actually, we in AIIMS we don't have that third year exam. We don't have. We have combined final year exam.
Yes, I know that.
Third prof and fourth prof. We have a single exam. So like initial in 6, 7, 7, like no one studies. Like so. Attending these classes gave an orientation what is final year exams, how heavy it is, like.
So yes, so was it useful for your professional exams?
Mainly useful for professional exam.
Right. And did it help to clear the concepts?
Yeah. Especially like some subjects like ENT and all, we don't study much in AIIMS.
Okay.
So all I know about ENT is from the classes I attended in DAMS.
Okay, that's nice.
Okay. So like there are some subjects like that you would never study in the institute.
Yeah.
Like in our in AIIMS we don't give much importance for ENT, ortho and all. Our postings are also short subjects.
Yes.
And postings are also not that. We don't usually skip actually all those things. So these subjects only from these classes I was able to catch up.
That's great. Okay, and then you followed it up with the test and discussion. So how do you find the fast track TND? So he did the fast track TND, which started in December. It started in December. So how did you find the course?
Actually, so what I did was like I planned like by Feb end I have to complete the full course.
Okay.
Then only I will have time to revise and all. So like I was attending the test and discussion, and along with that I was finishing another extra subject.
Okay.
So like double time.
That's a very useful piece of advice. He was trying to club subjects.
Yeah,
how did you decide on clubbing? Was it major and minor or?
Yeah, like I clubbed like path and medicine. I clubbed it.
Okay.
Then pharma and micro. So that we can cover up all this.
So how did you go about doing them? Did you do a few hours for each?
No. Actually, like it's in a week or something.
Yes.
So what I did is like first 3-4 days I will study for the other subject.
Okay.
And the last just before the TND, last 3 days I will study for that
subject. Wonderful.
So I was able to come by March first week I was able to complete it once.
Wonderful.
So then along with that same time I was giving the grand test of DAMS.
Okay.
Like every 2 weekly I was giving one grand test.
That's very good. That's how it should be ideally close to the exam.
So by March I was almost done like 5-6 grand tests and I've done this.
Okay.
Then in March what I did is like again I did more and more grand tests like rapidly, like every 3rd or 4th day.
Wonderful. So that's something very
by March and I was like I know like which topic I'm weak and whichever I have to touch on.
So I hope you're all listening to this. He did a fast track course where the time was less. He did an intensive study. The first part was planning, right? Following the classes and preparing the subjects accordingly. So you used to prepare 2 subjects together. Right, and the most important part that he said is he gave a lot of tests. Yes, he gave a lot of.
It's a must actually. Grand test is a must. You have to give it.
Yes.
Otherwise, like you have the knowledge, but you don't have like spontaneously it doesn't come out.
How to apply it exactly?
You won't be able to apply it, and like DAMS grand test was really useful for AIIMS.
Okay.
Like questions are really good. And even the test and discussion papers, even if I skip the classes, like if I feel like okay I'm okay with these subjects, I used to skip the class, but I will ask my friends to bring the paper, question paper, and I used to do it at home.
And so you find the questions
was really helpful.
Okay, great.
And then in April what I did was like there are some topics like you have to study the textbook. Like for anatomy, head and neck topic is there. Then like histology, you have to see the books and pics.
Okay.
Then parasitology, you have to read the book. Then it's like this Ganong book. you have to see every the flow charts and all. So in April first 3 weeks what I did is all the textbooks which are picks like Bailey and Lavka, first general portion you have to read, lot of AIIMS question from so I covered all these things in 3 weeks, like all the textbooks mainly. Then the last two, like April last week and May first week, 2 weeks I did a rapid revision. Like I read like whichever notes I had, I make lot of notes actually. So plus the whichever subjects which I feel like the class note is enough, I stick with that. And in like last 2 weeks I revised almost all.
So in when you were close to your exam, say last 2 weeks, what did you rely more on, the notes?
Yeah, you can rely only on notes at that time. And like at that time what I used to do is that morning I used to do all the notes, and at night I used to take actually I have that DVT. Last year I have taken screenshots which from
was
online.
it helpful for you?
So what I do is after 10 o'clock, 11 o'clock I used to see one subject.
And it's very good to revise the subject from those images
so
as well.
Like it's a good cluster of images you have, like I had a good collection of those things, and notes was also there if you have any doubt.
You can always go back and refer
especially
to them.
like ma'am your DVT images, then CCM. Like PSM, we call it CCM. Then surgery also was really good. Like these were the few things which I really liked of the pics. Like I had no idea of all those things. Then there I was also we are seeing that some SlideShare, some slides I have downloaded. Like for ortho they asked lot eponym fractures questions. So uska ek slide tha, so I read that. I have made a folder for that also. Like I used to, whenever I have a doubt I just Google it and download the image. So I keep it in a folder. So that I can revise in the last 2 weeks. So that was also very helpful for me.
Great.
And like
did you give the AIIMS mock that we conducted?
Yeah, I scored 9th rank.
So he got 9th rank in AIIMS mock.
And it was really confidence boosting. Actually after NIMHANS I was little bit depressed, like I didn't get a good score in that one. So when I gave this DAMS mock, I was like, okay, I can do it. It gave a boosting, like it was last 2 weeks time now. So it gave a boost, and with that confidence only I was able to revise all those things.
Wonderful, that's nice. And do you think the mock paper was on a similar pattern?
It was really helpful.
Exam is?
Yeah, a lot of, I think similar questions they asked also this time also.
Yes, we had almost 3-4 direct things.
And most of them were either from the previous based questions or somewhat similar to that kind. So it was really helpful for AIIMS.
That's wonderful. Okay. And so you've already talked about how you planned your revision and everything. And you know, do you feel that the DAMS notes are quite sufficient when you're preparing for the exams?
Yeah, it's really good, especially like ma'am, your notes is really good. Then anesthesia class was really good. Even the T&D question paper was also anesthesia. I really loved that paper. A really good question paper. Then physiology class also I really loved it. She was asking, she was putting question mainly from Ganong, so that's really helpful for him.
That's what we do at DAMS. We use standard textbooks to frame things, and that is just build on the newer updates, whatever keeps coming, and that is why things are quite similar or almost as it is. It is in the textbooks, so just in a concise format.
Then special for PEDS and ENT class also really good.
Wonderful. Okay, so that's great. And what do you want to pursue now?
I am planning to take radio diagnosis.
So he's planning to take up radio diagnosis. So we have a budding radiologist here, and I'm sure he's going to be a great one as well. Any piece of advice that you want to give to your juniors for times of stress, or how they should go about preparing for their exams, and whether it is possible or not?
We had a WhatsApp group, like in AIIMS only, all students, we made a WhatsApp group. So every day we will post, everyone will post one question or something like that. And like if anyone had doubt, we will clarify. So like it was a good group actually, like some 30-40 people were there.
But then you have to have everybody who is, you know, sort of interested in.
Only those people, like it's optional.
Because these days there are a lot of these distracting groups and what.
But this group was it was really good. So we post everyday questions.
Especially, you know, MCQs, it's a good thing to do it in a group.
So every day someone will post some questions. So you are getting like every day you are getting some 10-20 question extra. So it was really helpful.
That's nice.
And like they used to post pics also, so it's really good.
Okay, great.
Then like it's mainly like I stayed within the hostel, and like we were studying in groups. Like studying alone, it's really tough. That's the only reason why I didn't go home.
Wonderful. But
like within the group, actually you will be able to feel like, okay, you can do it. Everyone is doing. So whenever you are down, also it's easy to pick up.
Yes. But you have to understand that everybody is in the same boat. Everybody is doing hard work. There is no reason for us to, you know, feel bad about it. It's just a matter of few months, and now see how elated you are, and you're on top of the world.
Worth the repeating.
Wonderful, wonderful. So once again, we would wish a little message to your fellow Damsonians.
The thing is, like, there are lots of guidebooks, but you won't be able. At first time when you read, you feel like, okay, I will be remember everything, but you're not going to. You can't.
Yes.
So at the end of the whenever it's close to exam, you won't be able to revise it.
Exactly.
So it's better like you stick on to a lighter note, which has maximum information.
Exactly.
So stick on to that and revise it again and again.
Wonderful. So that's a wonderful last piece of advice. Stick to your notes, revise them repeatedly and consistently.
And give test, actually.
And
you have
give
to give
tests, yes. You have to know where you stand, and you have to, more importantly, you have to know what your weak areas are, so that you work on them and improve your scores. Otherwise, you stay static.
They show the subject-wise the score, where how much percentage you're making it, right? So it's really helpful.
Yes, so you know what your weak areas are, and you focus more on them, and that's how you don't stay static, but keep improving your score.
Like you have to work on your weaker subjects, otherwise you will always be stuck on a rank.
That's great, and I'm sure a lot of juniors will get inspired, and you know, they would want to do as well as you have, and we wish you all the very best from everybody at DAMS and all your colleagues, and hope you have a bright future ahead. Thank you so much for being here and helping out your juniors. Thanks.